I'm a hair mineral analysis expert. I have a background in functional medicine, and I educate people using HTMA testing to maximize health, erase debilitating symptoms, and gain energy. I'm a multi-time kettlebell sport world champion, and I'm constantly searching for high-performance pros from all over the world to bring you this human optimization podcast. My name is Lisa Pitel-Killah. Welcome to another episode of the Human Optimization Podcast. And today I have an amazing guest. His name is Dr. Shayne Young. He's a clinical director at Active Health Institute, where I work, and is a chiropractor there. He's a neurofunctional acupuncturist, as well as a functional range release specialist. That's a tongue twister.
Yes.
All right. Born and raised in Marathon, Northwestern Ontario, Dr. Young was involved with many different types of sports and outdoor activities throughout his entire life. His passion for helping others was evident. He even spent his summer months as a camp supervisor in a respite summer camp for children with autism at the Genoa Center for Autism. His intrigue for sport and physical activity has continued into his professional career, where prevention and treatment of sports injuries, particularly in strength-related sports, has been his focus. A strong believer and appreciation for the differences seen within individuals, with individual patients, Dr. Young incorporates a variety of different modalities in his treatment and is certified in diversified chiropractic technique, as well as Graston technique and contemporary medical acupuncture. Active therapy, which includes rehabilitation and exercise, and patient education play a key role in Dr. Young's treatments. So welcome.
Thank you for having me.
Absolutely.
Put it all like that makes me sound way more important than I actually am, I would say. But yeah, no, great to be here.
Well, excellent. Good to have you. And so, yeah, so I mean, tell us how, what attracted you to chiropractic? What attracted you to what you're doing now? Tell us how it all started.
Well, it all kind of started off when I was in high school, and I was going into my university application process, and I didn't really know what to do. So I was originally in biology. I was sent to go to McMaster University, and that was that. I was like, well, I guess I'll be a biologist. I like the sciences. Okay. But it wasn't until my last semester that I took human kinetics, and that was honestly life-changing. I went into it. I started looking at the human skeletal system, the musculoskeletal system, and pretty much instantly fell in love with it. I tell people all the time, it was the only course that I actually ever read forward in a text, which
I think we all have one of those in university, don't we?
most texts I would have a hard time keeping up with it. This one I actually read forward with it, and I was emphatic with how much I learned with it. I won the award for the class. I got the highest mark in the class, and I just loved it. I was like, well, what can I do in this sense that could work with the human body?
Yeah. And
so we did a little bit of research, talked with the high school counselor, and he was mentioning this human kinetics course, and I'm like, oh, wow, this is amazing. And so it was really late. I think it was probably February, March, when typical case with most university applications, you have to have it in by like October, right? And so I missed the cutoff for human kinetics at McMaster. So the only school that would take me was Lakehead University, which for me worked out pretty well. It was only 3 hours away from home.
Oh, nice.
And was able to make it home back and forth fairly easy, but went through the 4 years of undergrad for human kinetics. But it was before then that I decided I actually wanted to become a chiropractor. It all fell along kind of the same time. My mom, she was dealing with some very strong sciatic symptoms.
Okay.
And so we went to Thunder Bay for a surgical orthopedic consultation. And the surgeon wanted to, from what I remember being in high school, is that he wanted to be able to go into the surgery and cut her sciatic nerve.
Oh my goodness.
This is what I remember, right?
Yeah.
And this was 15 plus years ago now. So anyways, she was definitely afraid of that, didn't want to go through it. And one of her friends mentioned a chiropractor back home. And so she went in to go see Dr. Zawadzki, and he was on the traditional side of chiropractic. So he would do his adjustments and a little bit of soft tissue work, and that would be pretty much it. Yeah. But it worked out wonderfully for her. Her symptoms diminished quite a bit. She was able to kind of like get back into running.
Yeah.
And so I was like, oh, wow. So I shadowed him, and I did that for about a week. And I was like, this is awesome. I really liked it. And from that point on, I was like, I think I want to become a chiropractor. And that kind of veered me through my whole human kinetics undergrad, and then went to chiropractic college after that. And
and the rest is history.
Rest is history.
That's amazing. And what a great, having something personal like that that you can actually relate it to. Right? So,
absolutely. My mom is super ecstatic that I became a chiropractor. She's happy that I'm helping a lot of people kind of in the same situation that she went through, and makes her pretty proud that I started doing that.
That's wonderful.
Yeah.
Wow. Well, that's a great story. And I'll tell you, the first time my mother ever took me to a chiro, I was about 3.5.
Okay. Yes.
And so I have been going to a chiropractor pretty much my entire life. And so I know for me you put me back together on many occasions.
Her body can be a little bit of a mess sometimes, guys, but allows her to perform.
Exactly.
Yeah.
So I know that obviously you do Grafton, you do acupuncture, so some other modalities. Tell me what kind of led you to make those additions into your practice.
I think when you're as a chiropractor and you are going through the school, you tend to see that what's presented to you through school is somewhat limited. They give you a good foundation of adjustments, which all chiropractors they need to do. Some soft tissue work, not a lot of it, but then as you go through and you start to shadow other chiropractors, you tend to see, wow, what are you doing here? What are you doing there?
Right.
You see all these different tools, and you realize that's not part of the curriculum at school. And so you have to go out and find these different courses that exist for chiropractors, physiotherapists, massage therapists. And so you can add these tools to your toolbox as you go along through your schooling, so that when you are a full-fledged chiropractor, then that's when you can implement those tools within your systems of therapy. Graston was one of them. Actually, that was part of the curriculum, funnily enough. So we had that just automatically in there. But one of the big ones, neurofunctional acupuncture through McMaster University, is a very popular one for a lot of physiotherapists and chiropractors to be utilizing. To a small degree, some medical doctors will use it as well. Had a couple dentists that were in there too.
Oh, is that interesting?
Yeah, it was. They were just really interested in the TMJ and kind of getting away from just traditional like splints and mouth guards and that type of thing. But anyways, so that led me to McMaster University, and they offer neurofunctional acupuncture, which is different from traditional Chinese acupuncture.
Oh, okay.
Whereas traditional Chinese acupuncture is more related to the function of qi within the body, qi. And how you can manipulate the different meridians with the body to be able to bring in balance all these different systems, right? But with neurofunctional acupuncture, it's more on the biomechanical nervous system side of things, where for the majority of, I'd say, North Americans, it makes sense, where you're actually trying to influence the muscles, the tissues, the articulations, the nervous system, right? This is all things that you can hold and you can touch. So went through that, and that's a tool that I use every single day, and is absolutely integral to the therapy that any of my high-level athletes and even general population patients will benefit from. So that's using, same thing, just acupuncture needles, same type of thing that you use with traditional Chinese medicine, but it's how you approach it and where you put it in location with the body, and then how you also apply low-frequency electrical stimulation to it to be able to, whether you want to activate certain different areas of musculature, or be able to kind of deregulate the nervous system a little bit for some places that are just highly activated and just super tonic, what we say. Say the most common areas like upper traps, right? A lot of people, upper traps are really, really tight, so you might want to decrease some of the activation through there. So that's one of the tools that we can use for that too. And then on top of that too is just good old human movement. Just really trying to get people to move more. Like my motto here and what I have written up at the gym is move well, move often. So as adults, we just typically
we're behind a desk.
Yes,
right.
Stopped.
And we're kind of hunched over, right? Just because we're at the keyboard. And if we're not thinking about our posture, if we're not thinking about something so simple, it can affect us very, very negatively.
There's a point in time, and I don't know when it is, where you stop thinking about your body. And whether or not that's when you start to become an adolescent, you start to sit more. I have 2 young children, 2 boys, and I watch them move quite a bit, and it's amazing to see how they move and the different positions that they can get their bodies in. And I truly believe now that over time, the lack of movement is what will create a lot of problems for people going forward. And then, of course, just people being silly doing kettlebell and all this stuff. No.
He's not talking about me.
No, but doing all these different movements that particularly they may not have the movement prerequisites to be able to do these things, not only well, but safely too, right? So they may do something, say, I don't want to beat that horse, but CrossFit, for example, and I have nothing against CrossFit. I've done CrossFit. I treat a lot of people in CrossFit. But say a lot of people, they go into a CrossFit gym. Yeah. And it's really hard for a coach to be able to coach 20 different people. But if you're a brand new person that's in that class and they want you to go and do some overhead squatting, man, that's really hard on if you can't get your arms completely overhead, or if you can't get down into a squat movement and your hips are really locked up or your ankles are really locked up. And all of a sudden, it's like, it may not hurt your first time around, but after X amount of times, repeated times, you start to degrade, and that's when the injuries can come around, and that's when I start to earn my pay. But yeah, it's that lack of human movement over time, and then you come to the realization, yes, I need to start moving, and then that's when you can start to get into the bad injury.
Yeah. And we want to prevent that, right?
Yeah.
Performance is something, I mean, obviously for me, but for many other people who are either, competing or just want to be at a super high performance level, that's something that we have to take very seriously.
Yes.
Right? So
absolutely.
Taking care of yourself and making sure that you know and listen to your body. Because again, like you said, we stop thinking about our bodies sometimes, and we don't listen to, because our bodies are we're very smart, right?
Yes.
And there's a lot of functioning going on in there that we may not even fully understand. Yeah. So it's important.
You gotta listen to it, and every single time after I get the first initial consultation, I'll always tell people, when you get home, play detective. Yeah. Listen to your body more. Your body is always talking to you. You always have this proprioceptive feedback, but if you have your tuning frequency off by a little bit, you're not listening to what's going on in your body, you're not going to get the right information to be able to bring along to you, to bring along to me, right? And then that's when it makes our job a little bit more difficult, because now we have to start to speculate rather than just have the actual facts of what are your aggravating factors, right? So it's always about just listen to your body. Yeah. Try to get a better understanding of what your body is doing when you're doing something that makes it potentially hurt. Yeah. So.
And so obviously a specialization in or passion about athletics, right? And we mentioned kind of especially in the strength related sports. So tell us a little bit about, being performance driven. What are some of the common injuries you see kind of coming through the door of the office that you treat more often than not?
Yeah, that's a very interesting population to work with in the strength athletes population. It's
so define that first. What is a strength athlete to you?
The strength athlete to me is an umbrella term. So it's anybody that will utilize a weight to be able to gain, say, a certain performance factor. Okay. That's the way that I would put it. So say, for example, for you with kettlebells, right? You're utilizing that kettlebell not only as a training tool, but as a means of competition as well, too. Whereas every single strength athlete has the exact same standard. Whether or not it's Olympic weightlifting, you train with a barbell, you're going to compete with a barbell. Right. And the same as a power lifter too, and to a lesser part CrossFit, because then they'll utilize many different tools to utilize it, right? So a strength athlete to me is somebody who will utilize a weight to be able to influence some sort of performance factor. Whereas if you were to be a hockey player, right, weight is just an accessory movement, be able to gain more strength, but the overall performance portion of it is playing hockey, right? So
makes sense.
When I'm thinking about strength athletes and they're coming in, let's take Olympic weightlifters, for example. the majority of pain, I will say, that athletes will come in with will be anterior shoulder pain or anterior hip pain, front hip pain, front shoulder pain. And that's, again, too, I've come to relate that back to what do you do for the majority of your time during the day, right? We see how people sit cross-legged, arms crossed across the chest as I am. These type of prolonged positions will normally create a lack of range of motion. Your body's really smart. If you don't use it, you will tend to lose it to a certain degree. So now that you're taking your body that's so used to being in a folded up position to a completely opened up position, that's going to create stress. And a lot of it has come down to adaptability. Can your body adapt fast enough to withstand that load that's going through it so that it mitigates pain and injury, right? So for the majority of new lifters that are coming in, right, it doesn't matter which strength sport that you're doing, they are coming in because they want to get healthy, they want to get stronger, whatever it may be. But if they have been in this position for 6 to 8 hours a day, and then they go to move through an overhead position, and you don't know how to move your shoulder blade properly to be able to set it well enough, right? Or be able to brace through your core well enough, or be able to influence your lumbo-pelvic stability, all these different factors and variables are going to contribute to this bad load through your tissues and eventually lead to an injury, right? So front of the shoulder, biggest thing for most people is shoulder blades, bad position will impinge on your biceps tendon, create tendinitis of sorts. So that will create a lot of problems for most new lifters. And same thing for squatting movements. You see a lot of people squatting, and again, too, I don't want to beat on CrossFit here, but I also see in strength and Olympic weightlifting, but people squatting way too quickly. When you're squatting, it should be a very controlled maneuver. You should always be aware of your movement. But when you see people bottom out on their squats and there's bouncing, you're not utilizing the muscles as well as what you should be, and you're just bouncing off your joints, right? And it's momentum, right? And so that's going to slowly degrade the articular tissues and create some like impingement issues in the joint. And and that will lead to some pain. And if you just ignore it long enough, it'll eventually lead to an injury, and
it'll manifest into something else, right?
Absolutely.
It takes us back again to that, just listening to your body. And just a quick tiny little story for me with regards to that kind of repetitive movement building up. And mine was not necessarily doing it wrong, but my technique wasn't great when I was training for my first world championships. And it was still a really kind of new weight for me. And obviously with, thousands of repetitions you need to do to increase your technique and get better and better and better. And I actually, at one point, about maybe 6 to 8 weeks before the competition, I don't remember exactly when we left for Kazakhstan. And I actually went to the walking clinic because I thought my arm might be broken. And the doctor looked at me and said, I have never seen anyone break their forearm. And I'm like, well, I've never seen anyone lift kettlebells. I've been lifting a kettlebell and hitting it on my forearm for like 1,000, 2,000 reps. I'm like, can you just x-ray it? Because I knew that either it was broken or I had tendonitis. If I had tendonitis, then I could just work through that, which I should not. But as soon as I found out it wasn't broken, I was like, okay, I know it's just tendonitis, it'll get better. Yes. And I kept training.
Eventually it'll get better, and I can continue.
But that is not the right thing to do at all.
Yeah. It is
not a good idea.
It's a very give and take type of situation.
Exactly.
Where, you get to the highly competitive side of things. And I feel like only competitive athletes will truly understand what it takes to win sometimes, right? And for the general population that's just getting into this, they may think, wow, that's crazy. Why would you just hammer your forearm 2,000 times just to get where you want to go? But again, too, that's why you're not where Lisa's been, right? It takes that certain amount of tenacity and ferocity to be able to push your body past its certain limits And by no means do I ever really condone a lot of that, but at times I usually see it after the fact, right? So I'm like, well, you did it.
That's when I roll in and go, Shayne, something's wrong with my forearm.
You did it to yourself there, so let's try and put you back together.
Exactly.
But I would never say, listen, Lisa, you gotta push this one here. That's what coaches are there for.
Yeah,
right?
exactly. That's right.
But yeah, it's an interesting thing to see when people push their bodies to the absolute limits.
Absolutely.
But yeah, it's great.
Yeah. So let's talk rehab.
Mm-hmm.
A common injury, right? We talked a little bit about being able to set the scapula, right?
Yes.
Talked a little bit about the traps.
Yeah.
So kind of pick one and go through what the rehab might look like for somebody that has something not too serious.
Yeah. I'd say the most common thing is, like I said, like a biceps tendonitis that's kind of coming in through the front of the shoulder. That being a huge one when it comes to any strength related activity, particularly overhead movements too. And even if you're a weekend warrior and you just had to go and do some drywalling or something above your head, electrical work, whatever it may be, painting, that repetitive style movement will cause a lot of issues coming through here, right? So for a lot of people, it's about bringing it back to the fundamentals of human movement, right? And it is, number one, listening to your body, what's happening with it, but then next is learning how to move those certain articular movements, those joints or the musculature properly, right? So moving your arm from here to back down to your hip and above your head again, it's actually a fairly complex movement to do, right? Because you are utilizing your torso, your ribs, you're utilizing your glenohumeral joint, which is your shoulder joint, you're utilizing your scapulothoracic joint, which is your shoulder blade in the back, you're utilizing your neck to a certain degree as well too. But all these systems have to be working in conjunction and perfect harmony to be able to work properly, to have performance and pain-free movement. So it's about breaking down the movement and trying to get, say, singular adaptations to occur. So whether or not you're just trying to use your shoulder blade to work in its only range of motion that's available to it, right? So say it's like elevation or depression or protraction and retraction, right? Those type of movements where a lot of people, it's like, can you move your shoulder joint like this? They're like, no, I've never felt this before. It's like, your shoulder blade can do this movement. It can. And
surprise.
It blows my mind how many people that are just like, I had no idea my body could do this. It's like, yes, it can. And you will learn how to do it again. And then you will transfer that back into your movement, right? So bringing it back down to the fundamental movements, showing people how to move these through individual movements. And then you need to be able to load that tissue appropriately too, right? Because with most injuries, how it happens is that you train and then you rest. And then so the tissues are able to adapt, and you train, then it adapts, right? But so
it's like a roller coaster that's on an incline.
And it's on an incline, right? Whereas with most training, you want to keep that on a level playing field, right? But with most strength athletes is that you're trying to find that balance for yourself. That's, you just need to get that extra little bit every single time so that you can come back stronger and quicker and faster than before. But if you do too much, you don't rest properly enough, you're going to hit that tissue degradation where it's like you take a clothes hanger and you can bend that thing probably like 100 times, but it's going to get to the point where it will not bend back. It will be deformed to that portion, right? So yes, you need to be able to find that adaptability. So you want to load your tissue well enough. So you start off like really low weight to go through these very individual movement patterns. And then you just kind of build it up through your reps and sets your volume. And then you just kind of increase the intensity from that point on. And then once you get those individual movement patterns down, then it's about trying to put that back into a sport specific activity too, right?
Making it all work together.
Yes, exactly. So it can be a process for some people. And we can go down this whole other path with when
I feel like this is a rabbit hole. It's like, oh my gosh, we can go down this rabbit
hole. Yeah, absolutely. When new people come in and they have their very first injury, right? You think of your first injury in your first sport, you're like, everything was going so well, and then I got hurt, and then you can't train as much as you want to anymore, and you're missing your friends at the gym, and you're missing all that type of work, and you're just sitting at home and you're doing this boring rehab. Yes, there can be a lot of negative things that people can see, but there's a lot of positive things that come from it too. If you're willing to look past the negatives, you can learn from what happened and come back better as well too. Yeah. So you got to be kind of open-minded with it. I always say it's like, I take this quote from Dr. Stuart McGill, who's a spine biomechanist at Ottawa University, but there's always a gift of injury. Absolutely, so you have to be able to look into it and learn from what you did so that you don't do it again or have a very low chance of doing it again. And that way you can mitigate further injury from happening with that. So yeah, once you start to load everything properly, you put that back into the sport specific movements, it can take time, say from days to weeks, usually not months, but sometimes months. And then you just kind of start building it back from there and work with a coach, work with me or any one of the other practitioners, and then you just get back to where you once were.
And I think that too, a lot of times, and I mean, maybe it's not applicable to everybody, but a coach is important. Absolutely. Right? Absolutely. Because, they need to know, they know the level you're at. In kettlebells, we do microcycles. So, a microcycle might be 8 weeks, might be 12 weeks. It depends on how far out your competition is. But, you can't go in every day and, blow out a set with the 24 every single time you train. You have to have different, if it's a lighter bell, it's a longer set. If it's a heavier bell, it's a shorter set. And you microcycle up to a peak right before your comp. And then you get back down to the, 10 kg for 20 minutes or whatever it is to let your body recover. And I find a lot of athletes don't take the time to do that, and they just want to go all out all the time, and then they end up injured. So what's the most kind of common when somebody is injured, they have an injury, what kind of common mistakes do they make to set themselves back rather than forward?
So they're in an injured state already, and I see this happen all the time. It's simply stated as coming back too fast and too heavy. Right. So I'll always tell people as well too, when you're coming back after injury, start low and slow. Yeah. Low weight and slow movement, right? So society these days, we're really impatient. We want
we're fast forward.
Yes, we want that instant satisfaction.
Exactly.
Right now.
Yeah.
I want it now. And so with rehab, that's one thing that we've never been able to really speed up a huge amount, right? There's been definitely progressions made through time, but your body will do what it's going to do, and you have to listen to it, and you need to go through it, right? So the majority of the time, it's, I'll take an example from a recreational weightlifter. She was coming in, and she injured her shoulder, and then we had her kind of loading it slowly, right? How I was talking about before, individual muscle movements and articular movements. And then we had her getting back into the gym. And I see this happen all the time too. You get back to the gym, and the problem is it's not only you in the gym. Right? There's other people that are around the gym. And if you're joining a class, it's really hard for that individual to pull back. Right. Because they see a programmed workout in front of them. They're like, oh, I don't want to be that person to not do it. Exactly. Or I don't want to be like, I don't want to say like, I can't do this because I'm hurt, right? So people feel bad, right?
100%.
So they end up doing it, or they're trying to pull back a little bit on their own, but being sneaky about it. And then I see them the following week. I'm like, so how did the workouts go and all that? And like, well, kind of did some of the programming and it didn't really go all that well. And I'm like, oh, welcome to the club. I feel as well, a lot of athletes, they need to go through this cycle as well too. I'd say it's very infrequent that somebody will come in injured, that's an athlete, and follow the protocol to a T, and be 100% right afterwards. That's
Right.
the ideal thing.
Right.
But usually there is one or two hiccups along the road, and it's about trying to rein that person in a little bit just to be able to get them to learn the process and appreciate it's like, yes, your body does need its time.
Mhm.
Slow it down, low and slow, and don't be influenced by other people telling you gotta go, like, what's going on here, right? Like,
Yeah. And that's a hard thing to do.
it totally is.
When you're
It totally
used to
is.
it and
Yeah.
you want to do it,
Yeah.
I think that's the hardest part.
Mhm.
And when you want to do something and your body's just not responding the way you want it to.
And you love what you do.
Exactly.
You love what
Yes.
you love
Yes.
being there and all that type of thing. So I understand all that for sure.
But you will come back stronger, giving your body time to go through the process.
And like I said, you gotta learn. You gotta learn about it. It's not a perfect process.
I'm
but
still learning.
well, I think that's the sign of a good athlete, though, is always be learning about it. Right?
Yeah, always. So tell us about the self-care model, right? Athletes, I mean, the mindset about taking care of their bodies, some of the main movements that might be beneficial for them. I know it's very individualized, so it's hard to kind of generalize with a topic like that, but
it's pretty, I can put it in a general term. So with any athlete, whether you're competitive or recreational, there is a certain amount of maintenance that everybody should be doing, even if you're not doing any sort of strength training work, right? Motion is lotion. That's what I always say too.
I like that.
Yeah, so the more you move, the more your articulations will be able to be looped up and kind of ready to go, right?
Yep.
So for again, let's take powerlifters for example. So for most people in powerlifting movements, you're moving in what's called the sagittal plane of movement, which is everything that's going straight in front of you here. So a squat, your femurs are facing generally forward, maybe a little bit of external rotation, but your femurs are moving forward and the weight is just moving up and down, right? Or if you're benching, everything's in front of you. Or if you're deadlifting, you're pulling in front of you. So you have these very dominant movements, and your joints and muscles are meant to move through a vast degree of range of motion, right? So as a self-care model, it's beneficial to be able to explore these other ranges of motions. So trying to get people to move outside of their comfortable positions and to get them to move a little bit more. So say for some hips, one of my favorite movements called a hip 90-90.
Okay.
And so that's one where you're kind of sitting on the ground and you got your legs and knees all kind of like in this crisscross pattern, but then you move your hips through a lot of internal, external flexion, extension, range of motion, which generally the hips don't get when you're in that powerlifting sphere.
Yeah.
Or if you're moving your shoulders, right? One of the movement systems that I like to adhere to is called functional range conditioning. And so you can do these movements called CARs, or controlled articular rotations. So you are specifying movement at a singular joint, and you're doing slow, methodical movements to be able to get better active range of motion from the muscular tissue. So I say, for example, you see some people, I remember seeing this in high school all the time, guys grabbing like a 5-pound plate and just whipping their arm around, just like loosen it up, right?
Yeah.
But that's all inertia, and it's just momentum. And you're not really doing much. You're moving your joint, yes, but you're not really doing anything to activate or control the joint, right?
Yep.
So controlled articular rotations are very slow movements where you're taking your time and moving that joint through its full range of motion. It's a lot of times you get some clicking and popping, some burning, some spasming, some cramping, but it's because that joint is not used to doing what it should be doing, right? And so it's fighting against you because your body's not used to it. But if you do that enough over time, your body will adapt to it. And then boom, all of a sudden it's like, oh wow, I can move the shoulder pain free. And it's taken a little bit of time for your body to adapt. But now if I get my arm into a certain position, there's less chance of injuring it because now your shoulder has been used to kind of doing a certain amount of training in that area, right? So as a self-care model, It's just about trying to move your body outside of its traditional training movements. And for a lot of regimens that coaches will program for their individual athletes, I find they do a fairly good job of all the accessory work that's put in through it, that it will tend to get quite a bit of that extraneous movement and not just within their performance, specific performance movements, right? So yeah, if you get a good enough coach and you're following it, yes, this should be able to give you some of that self-care model, I would say. Yeah.
Excellent.
So, but it's very important, very important.
Yeah, no, it is for sure. And I know that my coach loves gymnastic movement, right? So different things like that, which is much different than just lifting kettlebells.
Yeah,
so,
totally.
So that makes it really interesting.
Gymnasts and dancers, to me, in my mind, are some of the two masters of human movement. Absolutely. They have control of their bodies through very crazy movements. But not only flexibility, but control of their body too, right? So to me, it's like that's what a human body can do in terms of movement, not strength, but movement. And it's phenomenal to see what a body can do when it's at its further spectrum of movement, for sure.
Yeah. Oh, that's interesting. So let's talk a little bit about the clinic. Tell us about the clinic, because listeners want to know, watchers want to know. Whether you're listening or watching, you want to know. So tell us all about the clinic.
So this clinic, we started up February 1st, right? And I wanted it to be a clinic where, again, strength athletes, it's all rounding around the strength athlete, because that's kind of where I found my particular niche in. I wanted strength athletes to be able to come to and be able to find proper care. So I knew it just couldn't be me to be able to help out with a lot of the Ottawa-based athletes, but we needed a team to do that, right? So I've known Lisa for years now, and I've always had in mind that I wanted to bring Lisa on board with me, but then also in the spectrum of physiotherapy and massage therapy. So with all the practitioners that we have here, which is a total of 10 now, which is phenomenal.
Incredible.
Every single one of them will have a certain amount of experience with strength. So if somebody were to come into the clinic and they're just, doesn't matter who they want to see, but if they're having a problem with their squat, or if they've injured their knee with a lunge, or with a jerk and the shoulder's hurting, then at least that practitioner will understand that movement. They would have done it themselves or known somebody to do it, and they're not like, wait a second, can you explain to me what a jerk is? Right. I always tell people, if you go to a clinic and you start to explain to your practitioner and say, like, my arm hurts doing this particular movement, and they don't know what that movement is, never heard of it, you're probably in the wrong place for your type of therapy. So we just wanted to have this clinic set up that we can be able to cater to that strength-based athlete in the Ottawa area, and know that we are equipped to be able to help them get through their injury, or even increase their performance as well too, because we're not just
it's not all about injury, right? It's about prevention.
Prevention.
So get ahead of it. Absolutely. and keep that preventative mindset.
So there's a lot of people that they'll come to see me and other practitioners just on solely a preventative / maintenance style work, where it's just, you're just trying to get a little bit of the body every single time they come in, to be able to gain that extra range of motion, or gain that extra little bit of activation through joint complex, whatever it may be. So two different spheres for sure, but we're very well equipped to deal with the injury side of things, and also well equipped to deal with the maintenance and performance side of the equation as well too. So we still been building. We just finished our 4th month last month, and into June already, which is not as warm as what I hoped it to be over here, but
it's coming. I feel like it's still spring.
But it's been great so far with everybody that's been working in here, and all the athletes that have been coming through here. We also have a new service called the recovery room as well.
Which, tell us about the pants. I'm always like, it's always about the pants.
Everybody loves pants. So it's these Normatec compression boots. And so they came out of the States. And so it's used to help with the movement of blood within the legs itself. So if you say you've had like a heavy leg day and your legs are just smoked, generally the vascular system within your legs have been overtaxed, and it's just having a harder time with all that fluid dynamic movement within the legs itself. And so with the boots, it's compression, and it'll work with kind of moving the blood flow distally, so from your feet proximally back up your legs into your torso, so that the blood can be reoxygenated, and all the nutrients can be pushed back down into the legs again. So it helps with that kind of venous return blood flow system, and then allow with all the arterial blood flow to get back into it. So it allows greater recovery, better adaptation to occur, and that way you can get back training maybe a little bit faster, because it's all about balancing that recovery with your training.
Exactly.
If you can recover faster, you can train more and get better performance out of the whole thing, right? So we have Normatec compression boots. We also have Mark Pro stimulation units, where we utilize it for pain reduction and also muscle stimulation too. So it's basically like the electro pads that you put on your body. Then we also have percussion tools as well too, which could be used on any sort of trigger points that you have in your body. So
they look like they come from Home Depot,
yeah,
but they work awesome.
Yeah.
It's like my car buffer at the gym.
Yeah, they are jigsaws.
Awesome.
Yeah, they are a jigsaw for the body, pretty much. So yeah, we have that, and we're selling passes where it's like a 5-pack pass, 10-pack pass. People come in for half an hour, book it on.
There's a TV in there. You can listen to music. You can watch a show. It's totally relaxing. Read a book.
So a new system to for some athletes to be able to try and utilize, and it's a new system that is out of the traditional. Come in and get yourself worked on by somebody, not just machines itself. So yeah, it's been exciting trying to implement that as well too. And
you know, one other cool thing, just with regards to the actual office, is there is a small gym space here. So when Shayne's talking about, you know, part of that rehab and the movement and some possible exercises to use, whether that's for preventative or for an injury, there's space and items that can be, so you can actually show what needs to be done.
Yeah, if you're in a clinic and you're a strength or an athlete in any sense, and there isn't a proper space to be able to assess and show
what the issue is.
What the issue is. Yeah. Like we have a squat rack in the gym, we have our bench, we have all our dumbbells, kettlebells, and barbells, everything that we need to be able to see people move. And so they're not just telling us about it, is instrumental when it comes to trying to figure out what is the problem and what can we do to help correct that problem too. So yeah, the gym spaces need that.
Because you're right, that is instrumental. You know, because coaching too, being a coach too, it's like when you're looking at someone do something, it's completely different than if they come to you and tell you. Because as soon as somebody comes to me and says, I have an issue, I'm like, show me. Right? Because then I know, looking at the whole picture, you know, what that actually is and what it means, and moving forward, how we have to change. So I think that's super important.
And a note for everybody watching, that if you're going to see somebody and you want them to figure out what's going on with you, and you're in a movement-based, performance-driven sport, bring a video. Because sometimes
that's a really good idea.
Because sometimes, as much as I can see people move and it's an empty barbell or put a little bit of weight on, sometimes the deficiency may not show itself until you are fatigued and you're further on in your workout. It's like, that's when I start to see my hip dump, or when my shoulders start to give out, right? So most people come into the gym, they're super fresh. So if you have a video of that particular movement, you see that deficiency happen, boom, perfect. Then I can see what's going on with it, and that gives me a better idea, rather than like, okay, I can kind of guess what's going on here, but it gives me a better idea as to the road that you want to take with the entire recovery of that injury. So bring a video in. Very, very helpful for the practitioner.
That's excellent information. So you know what, you can check us out. Want to give the website, just spell it out for us, just in case our listeners on iTunes or Spotify.
It's hintonburg.activehealthinstitute.com. So HINTONBURG.active Health Institute. Do I need to spell that one out?
No.
.com.
I'm like, no, you don't need to spell that out.
Oh,
I'm
okay.
pretty sure we know. But Hindenburg, people want to put an E in it, so I'm like, so
Yes,
make sure you spell
sometimes
that
they
out,
do,
so
yeah.
just so that they know where to go. Yeah, lots of great info on there. You can actually see pictures of the clinic and all the practitioners that work here and all their specialties, and lots more info. And if you want to book an appointment, obviously that's the place to do it.
Mm-hmm.
So we're just about out of time.
Okay.
That was excellent. Thanks for all the info. And so anybody looking for preventative therapies, or if you are injured and you're an athlete, then Active Health in Hindenburg is your place to be. So thanks for listening, thanks for tuning in, and thanks for watching, and we'll look forward to seeing you next time.
Thanks, guys.
Thanks for watching today's show. Head on over to Killah, KILLAH.org to gain access to some amazing resources that will help you gain energy, rid yourself of debilitating symptoms, and be the best version of you. Remember to give us a like and follow us on Instagram at coach.killah. We're here every 2 weeks with a brand new episode of the Human Optimization Podcast. Until next time.